To all the girls I've loved before, who've traveled in and out my door, I dedicate this song. Oh, sorry for the musical interlude. Good morning. My name is Dr.Pettle, and with my wife Carol, we won the Pettle Wellness Center, dedicated in the memory of my beautiful mother, who I'm looking at right now, who we lost April 27th, 1985, 1:30 on a Saturday morning. And I remember as the blood trickled down the right side of her face, and she passed away from breast cancer. Carol held me, and I promised Carol that she would never be forgotten. So her soul is always in this room. And I was fortunate enough, along with my brother Shelley, by the way, Shelley, happy birthday, happy Valentine's Day, to Alex, and to my little brother Jerry, happy Valentine's Day to you, Susan. This video would be one of the first 30 videos that I hope to make in memory of my mother. And I'm through the telling of my life story, my incredible passage. There have been 3 women who have been the most significant in my life, and will always be the most significant in my life. My beautiful mother, whose smile I see right there, when I graduated in 1969 from the University of Toronto. She was so proud. So was my dad. She was incredible. I remember the day she died, and we were at the Steel Memorial. There wasn't a seat in the place, and someone had said to me, which I probably already knew, that my mother never had a bad word to say about anybody. Her father was a scholar, Morris Eisler. And by the way, happy Valentine's Day to you, Auntie Carol, Sheila, Auntie B. This is really my Valentine's wish to all my patients. And if I do forget somebody during the giving of this introduction to my lectures over the next year, forgive me. This is done live, and there's a saying in my book, what comes from the heart goes to the heart. So there's no script. This is the truth, and hopefully you'll share it with a couple other people who may find some help in the medical advice I give over the next 30 lectures, along with stories of our lives. You know, they say that it is the pupil and the teacher that makes the teaching. So I also dedicate this first lecture and all my lectures to the patients who have sat in front of me and taught me so much. My next book will be called What Women Have Taught Me. It will be an encyclopedia, according to many of my patients. The people who have come to the Pettle Wellness Center understand the importance of preventative medicine, understand the importance of health. Today's Valentine's Day, and this is my way, and Carol, my wife, our way of starting off, saying thank you and giving short talks on wellness. Today I'll talk about the heart, since it is Valentine's Day. The second person who I would like to also thank is Naomi, who gave us 2 of the most incredible children. And Jordan, happy Valentine's Day to your beautiful wife Shannon. Adam, happy Valentine's Day to your beautiful wife Tricia. The third person, of course, is, as you know, Carol, my wife, who has given me, well, the truth is I wouldn't be sitting in front of you right now if it wasn't for Carol. Whoever thinks for a second that women are not the strongest of the sexes, being in one delivery and watch a woman giving labor, believe me, men could not do this. It's Valentine's Day, and I'm going to talk a little bit about prevention of heart disease. A lot of patients out there are taking Crestor, Lipitor, statin drugs. When my patients have an elevated cholesterol, what I usually do is ask them to take red yeast rice, 600 milligrams, 2 tablets at night. Statins block a pathway. They block a pathway towards cholesterol. And although many physicians think that that's a great thing to do, and that's controversial, statins have side effects, major side effects. And CoQ10, the antioxidant, which is the most important enzyme for the heart and for the brain, is blocked. The production of CoQ10 is blocked when you take a statin. So anybody who takes red yeast rice or statins should be on CoQ10. I compounded a CoQ10 prescription. Carol's family has a strong history of cardiovascular disease. I'm a diabetic myself, so I take CoQ10. And it is the most important enzyme, as I said, for the brain. And in nursing homes, people take 11.5 drugs per patient. And many of them take statin drugs. And those patients are losing their minds, some of them, because of those drugs. And ask your doctors to make sure that your loved one who is perhaps in a nursing home gets a CoQ10, 100 milligrams at least, to block the loss and allow the patient to have CoQ10 and prevent some Alzheimer's and other diseases of neurological origin. My book, Prescription for Life, was dedicated to Carol in 1994. It's over here somewhere. I don't know if you can see that. It's Carol and I walking in the park with Sam at the corner of Young and Lawrence in Sherwood Forest Park. And the year was 1994 when I walked away from medicine for 6 months. And at that time I had already had the incredible privilege of delivering 10,000 babies, but I had lost my path, and with my help of my wife, Carol, and everybody who loved me, I took 6 months off. And I read books that I had never read before. Books by Jonathan Wright, Julian Whitaker, John Lee, the late great John Lee in the United States, who was a great defender of progesterone. You see, the whole question of hormones, which we'll go over in the next 30 lectures, is not that controversial to me. The study that happened in the summer of 2002 was no surprise that synthetic drugs caused heart disease, embolus, breast cancer, because the body knows you can't give the body something that it doesn't know how to process. And the route to taking an oral estrogen is absolutely the worst thing you can possibly do, because the liver does not make estrogen. It turns it into estrone, and that's the most cancer permissive of all the 3 estrogens. Doctors should remember that there are 3 estrogens: estradiol, E1, estrone, E2, the most cancer permissive, and then the forgotten hormone, estriol, the hormone of pregnancy. And while I'm on the topic of estriol, that's how I met my beautiful wife, Carol. I was in my first or second week at Etobicoke General Hospital, and I was showing the girls how to map estriols on a pregnant patient, because the hormones for pregnancy are progesterone and estriol. Estriol is the weakest of the 3 estrogens, and it's the hormone that protects a male child when it's in the womb of his mother. So estriol is what I prefer, along with some estradiol, on the same ratio as the body has, 80-20. And I use a cream called Biest, along with progesterone cream, of course. And later on we'll get into some studies that I will tell you about that will prove, without a doubt. I mean, most physicians, allopathic physicians, they mean very well, and they do a great job. They saved my son's life. And they mean no harm, but they haven't thought that maybe medicine should move on in some fields. And hormone replacement is one field where around the world there are many physicians like myself who practice integrative medicine and do bioidentical hormones, transdermal, transvaginal, sublingual, rather than give synthetic drugs to the patients. And I can tell you, after 15 years of seeing the most beautiful women in the world walk in here, you're going to spend now 1/3 of your life perhaps in menopause or andropause. And why shouldn't you have the hormones that you had all your life to protect you from all the diseases that may come upon us as we get older and weaker? We don't get old and die. We get old and lose our defense. And hormones are anti-cancer, anti-inflammatory. Speaking about inflammation, and getting back to the heart, since it is Valentine's Day, and I'm dedicating this, of course, to all my patients. Besides CoQ10, obviously there's many more things you can do to prevent heart disease. My patients already know about water. There's a mathematical fact that you have to drink 1/2 your body weight in pounds equals the ounces of water that you should drink. Sleep. You can't lose weight without sleeping. You have to get into a REM sleep. And we'll talk about things like happy sense and melatonin and the benefits of those terrific herbs and supplements. But the heart, is an incredible organ, and we are meant to live a very long time. Why not have the hormones we had all our lives? And why not live longer? Today's 70, as I hope yesterday's 50. On a personal note, I look around this room and I see, well, one of my patients last week or 2 weeks ago said to me, you know, Dr. Pettle, walking into your room, there's a new patient who it's like having a hug. And every morning I leave a message, my thought for the day. Patients call my phone. Unfortunately, sometimes they can't get through to me. Believe me, I'll work on that. But they call the phone, and sometimes just to get the message that I've left for the day. I started collecting them when I was an intern in 1969. I never slept for the first 24 hours of my medical career. And you could write a book. I will, and I have written a book. I've kept a diary since I was 24 years old and an intern at New Mount Sinai Hospital. And I'll tell you about that and more as we get into more lectures. Today is just an introduction as to what I hope to do for the future. I will have a tripod, and I will have cameras, and I will have words come across the screen along with slides. This is just a homemade introduction to our place, a place that is dedicated to the memory of my mother. Breast cancer is a devastating disease, and every one of us in this world will be touched by, in some way, by cancer. When my mother died, I think at that moment I knew that maybe God had selected me. He had given me certain gifts of intuition. I could sense when life was in trouble. I could sense when life was coming into the world and when life was leaving the world. I remember on a Saturday afternoon one day, and this is where women's wisdom comes in, and that's another book I read, Christine Northrup's book. I remember on a Saturday afternoon I was on call, and we lived at Don Valley Parkway at Eglinton. It was from labor and delivery, and I was called over the weekend. It was about 2 o'clock in the afternoon. And it was labor, and there was a patient in early primip in labor, 2 centimeters dilated, waters were clear, had ruptured her waters, and everything was great. And they said they'd call me back and let me know when I was needed for delivery, perhaps in 7-8 hours. I put the phone down, and I had a discomfort in my chest, and I walked around, and Carol said to me, "What's the matter? You don't look right." I said, "I don't know, I just, something doesn't feel right. My chest's got discomfort. It's not indigestion." She said, "Is it something about the patient?" I said, "Well, I don't know. There's something's not right." She said, "Are you going to go to the hospital?" She knows me better than I know myself. And I said, "Yeah, I guess I'm going to go." So I drove to Etobicoke General Hospital, which about a 25-minute drive, which is now the Sewell Mosler Center. And I parked my car, walked slowly through the front door, and went towards the OR and down the labor and delivery hallway. In the darkness, I could just see at the end of the hallway a gurney was flying across from labor and delivery to the OR with a great deal of panic. So I walked down with my jeans on that I wear, as you know, in the office. And I opened the door and I saw two very frightened nurses with a patient who I'd never met on a gurney with the fetal cord prolapsed down onto the gurney. I walked into the room, fully clothed, and just put a pair of gloves on and felt the cord, and it was still pulsating. And I put a pair of gloves on to put the head of the baby away from the cord, because if the cord, every contraction would allow the baby's blood supply to be cut off, and in a matter of moments the baby was going to die. I introduced myself to the patient in a rather peculiar way. I had my hand pushing the baby's head out of the pelvis, and asked her, told her I was Dr. Pettle and I was on call and that the baby's cord had prolapsed, but the baby was still alive. And I asked her to get into the knee chest position with her head down. I then looked at the girls and said, "Is Dr. Davies here?" His picture's over there. Actually passed away. And he, on a Saturday afternoon, didn't have to be there, but fate meant that he would be there. And he was walking down the hallway. And he looked at me and I said, "Come on in. This is Mrs. X. Course prolapse, Dave, and we're going to do a stat cesarean section." So I explained to the patient that I was going to put some betadine on her tummy and turn her over and ask one of the nurses to put a pair of gloves on to hold the baby's head away from the cord. Went and scrubbed. I did put a gown on and a mask. I went to scrub and the baby was out probably within 3 minutes. When I put my hand into the uterus, I could almost shake hands with the nurse who had held the baby's head up. And I pulled the baby out of the uterus that was as pink as this shirt, which I wore for Valentine's Day. Why was that baby meant to live? And what is it that I was feeling in my chest? To me, I think that when someone is praying, they're in direct communication with God. I think if you do something with all your heart and soul, I think you have a certain intuition, a certain feeling of whether something feels right in your chest. And you know when something feels wrong as well. In doing obstetrics for gynecology for 46 years, I think that being in the now moment and being connected to the patients and loving the patients, I say this with all my heart. And by the way, what comes from the heart goes to the heart. My patients know how I feel about them. And you have to feel that way because they're giving you their life. And it is an incredible honor to be given a part of someone else's existence. That's someone's mother, someone's sister, someone's daughter. And now, at my age, they're now coming in, and they're actually babies that I delivered myself. I recall one afternoon where a young man walked into the office, and he came in with a lawyer who was asking me about my opinion about a lawsuit. And when the young man sat down in the chair, I looked at his eyes, and I looked at his eyes again, and I said, "I've seen those eyes before." And he said, "Dr. Pettle, you delivered me." And then I said, "Yes, your mother's name was Lynn. She was a stewardess." And his beautiful blue eyes, you can tell that I'm a man who believes that the soul is seen through the eyes. I could see his mother's eyes in his eyes. And to this day, the other lawyer said she had chills when she heard the words from this young man, because I didn't know his name, and he told me his name, and I delivered his brother and sister later on. He also confided in me that when I delivered his mother, I snuck his father into the delivery room. Even then it wasn't allowed. I guess I was a person who did what I felt was right even back then. Back in the 70s, I used to deliver babies into a warm bath and put the lights off. And there was a Frenchman named Dr. Leboyer who felt the trauma of birth. No wonder the baby was screaming. And that was it back in the 70s. I think McLean did an article on that. But I digress. You'll find that I do digress from, I guess there's segues. Aaron, happy Valentine's to Aaron Davis. Aaron, who I listen to on 98.1, tells me what a segue is. And so when I sometimes say one thing, it leads me to another place. So I'll come back to the heart, and I'll come back again to saying Happy Valentine's Day. In prevention of heart disease, of course, patients understand that obviously there's no use me giving bioidentical hormones if they've got 2 packages of cigarettes in their purse. But most patients who come in here do not smoke. Actually, you can actually smell the smoke on patients who do smoke, but it's so rare in this office. One puff of a cigarette, I think, produces 10,000 radical that cause 100 times the potency of damage to the cervix and obviously the lungs. So if someone is a smoker and they come to me, I'd rather them stop smoking, so I'll give them advice about how to stop smoking and ask them to see one of our colleagues here, Dr. Walter Orlowski, who does hypnotherapy, acupuncture, another physician here who also helps in the clinic is Dr. Benjamin Merzel. He does acupuncture. Here we also have Dr. Alexander Mossman, by the way. Alex does thermograms here. We talk about thermograms another day. Happy Valentine's Day, Tally. And congratulations. So Alex is here doing thermograms. Beside me is Dr. Raisa Westpaper. She's a homeopath who's my homeopathic physician. My allopathic physician is Dr. Greg Pusian, who does anti-aging and male anti-aging hormones with testosterone and does intravenous Myers cocktails. Also in this building is Dr. Sonia Kuska, who I owe a great deal of debt to. It was her office that I took over 15 years ago when I started to think about doing integrative medicine. I remember at St. Clair and Avenue Road where her office was. Remember, I'm an obstetrician gynecologist, and a man walked into the office, and I was covering her office because she was pregnant. And I had to do a physical on a man. Now, this may sound strange, but when I walked into the room to do a physical on the man, I was embarrassed. I didn't know where to start. I knew, certainly, as a gynecologist, where to start. But I really don't think he'd appreciate a pap smear at the time. I got through the physical, and I still do remember being an intern, but it was many years ago. It was 1969. But now that we've moved to 3910 Bathurst over the York Downs Pharmacy, and also, by the way, happy Valentine's Day, Fran Garshowitz. Happy Valentine's Day to all the people who are today. Perhaps someone will tell you that they love you. Someone will look at you and say Happy Valentine's Day. But if they don't, then please remember this message. You are loved, and you are on this earth for a reason. Make each moment count. The now moment, I mean, I guess maybe some people think it sounds hokey, but I do really believe in the now moment. I believe that it's the only thing that really counts. And if you make that moment count, you tap into an intuition that's way beyond intellect. And that's perhaps how discoveries are made. I remember one day that I had 3 patients walk in, all within an hour, who had taken oral DHEA pills down in the United States. A 40-year-old woman who had terrible PMS, breast tenderness, nostalgia, headaches. And within the same hour, a menopausal woman who had menorrhagia, heavy bleeding. And I guess towards the end of the hour, a postmenopausal woman who had bleeding. And I asked all 3 patients, because they'd been on bioidentical hormones for a couple of years, was there anything that you were taking over the last few months that I wasn't aware of? And they all 3 said, yeah, I went down to the States and bought oral pills of DHEA. I heard it was good for you. DHEA is dehydroepiandrosterone. It's the opposite hormone of cortisol. And cortisol, as you know, is the hormone of stress. It's the one that puts fat around the middle. And it's the one that used to be a survival hormone and allow us to, I guess 2,000 years ago, stay in a cave and live off the fat of our stomach. Unfortunately, in the stressful world we live in now, I think we all still feel that we're still in a cave, and this world is a dangerous place. I hope we can change that. Actually, if the world was run by women, and I'll be the person who's leading the parade when it comes back to a matriarchal society, we wouldn't have this killing and death and testosterone-ridden world. You know, the dose of a testosterone medication, transdermal or transmucosal, in a woman is 1 to 5 milligrams, and in a man it's 100 milligrams in the morning and 50 milligrams in the afternoon. You can understand why this world is filled with so much anger and aggression. And while we're talking about DHEA, and we're talking about those 3 patients, after the door closed when the 3rd patient left, I remember just shaking a little bottle of homeopathic drops that Raisa had given me. And I thought to myself, of course, DHEA is converted to estrone in the liver, and they're causing themselves to produce cancer. Men getting breast cancer and prostate cancer, and women getting breast cancer. And we live in an estrogen-dominant society, so I thought to myself, how could I possibly invent something that would give patient DHEA without going to the liver? And the answer was, I was shaking the bottle. I looked at the liquid and I said, well, maybe I'll put the DHEA into a liquid. So I put 10 milligrams into the liquid. So if you drop DHEA from a dropper, I think 1 drop contains 20 cc's, and that's if it's water, and 1 drop would contain 40 cc's if it was alcohol-based, which you have to use for DHEA. So if a person uses 5 drops under their tongue, or 10 drops under their tongue in the morning and 10 in the afternoon, that would be 20 drops, and then 10 milligrams per ml, that would be 5 milligrams of DHEA under their tongue and into the circulation. Now here's the key. If it gets absorbed into the circulation and goes to the brain assumes it comes from the adrenals. And that is exactly what you want with all hormones. DHEA is like the military. It's an anti-inflammatory, it makes growth hormone, it prevents cancer, prevents infection, it makes us younger again. Our DHEA drops by 1 point every 10 years. And my patients are thrilled when they see that the DHEA they walked in here with 5 years ago is lower than the DHEA they have now. And they're getting it through absorption into the circulation. And the body is lowering the cortisol, the one hormone that is kind of the last girl standing. It's the very reason that 80% of the patients who come to this office are here. It's because of stress. Yin and yang is very important. Cortisol and DHEA are yin and yang, the DHEA being the yin, and estrogen, which is actually 3 estrogens, and progesterone are like the yin and yang. The yin being progesterone, it relaxes you, makes you sleep. This is why it drives me crazy when patients have hysterectomy and they're given only estrogen. Never in their life did they have only estrogen. So why would you give a patient only estrogen? Progesterone, the number 1 organ for the progesterone is the brain. So your patient's not going to sleep if they take estrogen by itself. So progesterone taken at nighttime is sedative. The breakdown products are sedative. And progesterone is taken through the skin, in my practice, or transmucosal. And estrogen is always taken transdermal in the form of biased. Before I get into too many of the medical studies and many of the things that I want to talk about, I think what we'll do is we'll set up a series of lectures that will be sent out, and the topics will be organized in an orderly fashion. Today I've just talked basically off the top of my head, and I hope that this video will help you understand that what is being done in this office is the future of medicine. Despite the allopathic world, big pharma, and some people do need drugs, and some patients require anti-cancer medications. But prevention, Hippocrates says it's better to know the kind of person that has a disease than the kind of disease a person has. And I think we have to reflect and sit back and say to ourselves, we made a mistake for 50 years, and we now have to let the world know that estrogen has to be cut down. Red meat and dairy are full of estrogen, so a patient who's got estrogen dominance and PMS in my practice, if they do eat red meat and dairy, then they have to do it during their menses, not during the time when estrogen is rising in the middle of their cycle. These are basically things that are taught to medical students, but the practical application in a patient's life is perhaps our whole reason for having Ruth Pettle Wellness Center. I hope to have you meet Carol. Most of you have met Carol on the phone. I would like to really finish up with thoughts about Carol. You look around this room and you know that Carol's not just the wing beneath my wings. She is my wings, and I wouldn't be here if it wasn't for her love that brought me back from a place that in 1994 only she, only her love could have brought me back. So, darling, on this Valentine's Day, I thank you with all my heart for being who you are. God has given me many gifts, but you are the greatest gift God has ever given me. I'm going to stop now and come back and talk to you later. Have a great day.